Hi there, I'm Teresa Dufour with today's CT Style Express report. So, for many people, changing their eating habits, modifying their behavior, and exercising is the best approach when trying to lose weight. But sometimes weight loss surgery needs to be part of the solution. Here with more is the director of Middlesex Health Center for Medical and Surgical Weight Loss, Dr. Jonathan Aronow. Nice to see you again, doctor.
Thanks for having me again, Teresa. It's good to be here.
All right, so a couple questions, doctor, about weight loss surgery. When does someone need to consider a surgical aspect of this?
Well, weight loss surgery is really a health preserving surgery. So when we start seeing health that's compromised by extreme weight, that's the person we want to intervene with. Usually we're looking at 80 to 100 pounds overweight, or what we look at is a BMI, a ratio of height to weight, and a BMI of 35 or 40 or more are the criteria to qualify.
Um, and then you mentioned, is there a candidate for surgery? Just that BMI we're looking for?
Well, that's the most important one is,
Yeah.
at a certain weight threshold where health becomes compromised by the weight. But we also are looking for patients who have tried exercise, diet, the things that you mentioned. But those are rarely successful at this extreme level of weight. The other thing we're looking for patients who really fully understand what they're getting into, have a fairly firm psychological grounding. So people with uncontrolled depression or addiction problems are not ideal candidates.
Sure.
But otherwise, it's really a health decision.
Right. And how would you say the approach is different over at Middlesex?
Well, Middlesex is really developed a program. I've been here at Middlesex for 22 years with the bariatric program, and we've grown it from its infancy. And at this point, it offers both surgical and medical treatment. So even patients who are not to the weight extreme that might qualify for surgery, we have medical programs that include diet, exercise, dietitians, frequent follow-up support groups, as well as medical treatments that might be appetite suppressant medications. That's kind of unique from many of the other programs. So we integrate that with the surgical program as well for patients who may need both things.
Right. You're not on your own when you're at Middlesex, then. That makes
Exactly,
sense.
exactly.
Doctor, let's talk about some of the procedures. SADI and SIPS, I think you could go into better detail than me.
Well, those are two of our newest offerings. So traditionally, gastric bypass and sleeve gastrectomy, those are the most common procedures in this country. The sleeve gastrectomy, which is the most common procedure, is a surgery that really sort of removes part of your stomach and leaves you with a narrow portion of the stomach. Now, one of the things that many people don't understand is weight loss surgery is metabolic surgery. It's not designed to just make you have a small stomach and then feel sick. These surgeries remove a portion of the stomach that get rid of the hormones that stimulate appetite. So we're getting rid of appetite so that you can eat a small meal and feel full.
Mhm.
So one of the things that happens with the sleeve, we remove part of the stomach, but it's not as potent as the older gastric bypass where we do intestinal rerouting too, which has an even more potent effect on hormones. Well, there's another procedure called SADI or SIPS, which are variants of something called a duodenal switch. And I don't want to throw a lot of terms at you, but what they basically do is combine the elements of the sleeve with the elements of a gastric bypass. So we have a sleeve procedure where we remove a portion of the stomach, and that removes the hormonal portions of the stomach that cause hunger. And we connect it to part of the intestine, bypassing some section of the intestine that gives you a lot of the sugar sensitivity. So with the SADI, it gives you more profound weight loss. It gives you more profound changes in your blood sugars. In fact, it has about an 85 to even 90% cure rate for type 2 diabetes. And that cure rate is overnight. We see our patients going home off of all their insulin almost immediately. So even for those patients who are insulin dependent, it carries about an 85% cure rate
Ah,
for
that's
diabetes.
incredible. Doctor, is this something that insurance would cover?
Well, many insurances do cover. Many of the insurances may cover what we call a traditional duodenal switch as opposed to the SADI, which is a little bit more complex in its construction. And sometimes we have to go through appeals. And one of the other things in Connecticut, the insurance coverage is poor compared to the Northeast, where we see only about half of the constituents of this state have coverage. Right now, most of the larger companies, state employees have coverage, but many don't. And there's actually a bill in the state legislature right now called SB 107. So if anybody's interested in weight loss surgery, struggled with weight, I ask them to contact their legislator to encourage them to support SB 1007 to help us get coverage for everybody, because it saves the state millions of dollars in healthcare costs.
Very good. Doctor, where can we learn more?
Well, certainly you can go to the website, Middlesex Health. You'll find the weight loss program there, or you can even just call a simple 1-860-OBESITY, which gets you in touch with our nurse navigator who can help navigate you through this whole process, whether you want surgery or medical health care.
Very good. We appreciate your expertise. Thank you for chatting with us today.
Thanks for having me back.
All right, that is your CT Style Express. We'll see you back here tomorrow.